We would like to welcome you all to the Community Violence Intervention Addressing Gangs, Understanding Violence in Your Community webinar. As a reminder, this webinar is being brought to you by the National Gang Center, which is supported by the Office of Juvenile Justice and Delinquency Prevention. The National Gang Center exists to help communities implement comprehensive solutions to prevent gang violence, reduce gang involvement, and suppress gang-related crime. For more information about the National Gang Center, we recommend visiting our website at nationalgangcenter.ojp.gov. I will now turn it over to our moderator for today, Director Mina Harris of the National Gang Center, to begin our webinar.
Thank you, Sterling. Welcome, and thank you for spending some time with us today. We began our webinar series this year. With an introduction to the OJJDP Comprehensive Gang Model. This is a data-driven framework for coordinating multiple violence reduction strategies. It is also a framework that optimizes the efficient allocation of a community's existing resources for implementing violence reduction initiatives. We followed that with 3 webinars focused on gang-involved youth and young adults. One was a webinar on street outreach and another on multidisciplinary gang intervention teams. These are 2 components that are integral to the comprehensive gang model. In addition, we provided a webinar discussing why youth may join gangs and recognizing the differences in gang involvement. Now, we are going to take a step back and focus on measuring gang crime and violence in the context of the gang landscape within a community. So to this day, there is still no universal consensus on the definition of gang, gang member, and gang crime. The definitional debate continues in the research discourse. Statutory codification or laws of these terms varies across states and at the federal level. Apart from self-identification, documentation of gangs, gang members, and related crime is inconsistent and can lead to considerable bias. These challenges are complicated and have stalled progress of some community responses. They've misguided other community responses and led other communities to avoid the terms altogether. Amid this ongoing debate, from the National Gang Center's perspective, what is important is to stay focused on the recognition of the cycle of community violence and its devastating outcomes. We do know gang activity is characterized by the use of firearms, crimes committed outside, such as drive-by shootings, the involvement of multiple individuals suspected of criminal activity, and often a relationship between victim and offender. Gang crime and violence is unpredictable. It is often retaliatory. It generates considerable fear among gang and non-gang members in a geographical area. Gangs promote themselves through graffiti and through social media. The presence of gangs can create an atmosphere of threat and intimidation in the community. Gang-affiliated individuals are at a significantly increased risk for gun victimization generally. For communities experiencing this type of gang violence, whether perceived or real, it is imperative to begin with an assessment to determine the scope of violence, what is driving it, and who is caught up in it. We will begin today with a presentation that describes why a community gang assessment should be conducted before implementing responsive programming, review some of the data domains that are part of the process for conducting an assessment, and finally, as part of the presentation, as well as the panel discussion to follow, identify how a community gang assessment drives strategy. With that, I would like to introduce Dr. Charles Katz. Dr. Katz is the Watts Family Director of the Center for Violence Prevention and Community Safety and a professor in the School of Criminology and Criminal Justice at Arizona State University. Much of Dr. Katz's work has focused on understanding strategic responses to gangs. He has served as the principal investigator and consultant to several gang assessment and organized crime research projects in the United States and in the Caribbean, including projects for the National Institute of Justice and the United States and the United Nations Development Program. Dr. Katz, over to you.
Hi, thank you very much. So my name is Charles Katz, as Mina just stated. I'm a professor of criminology at ASU, director for the Center for Violence Prevention and Community Safety. In way of background, over the past 20 years, I've conducted gang assessments, either by themselves or as part of larger projects in a number of different types of communities. And I'm bringing this up because we're going to use some of these case studies that I've worked on as part of our discussion today. And so some of the communities that I've worked in are what we might consider chronic gang cities, cities that have had long-standing gang problems, substantial amounts of violence, including homicide. These are cities like Compton, California, Inglewood, Flint, Michigan, and others. And then all the way to the other side of the continuum, communities that have had what we might consider emerging gang problems. Communities like the Tri-Cities, Washington area, communities like Napa Valley, California, Phoenix, and then a number of those that probably fall in the middle somewhere like Albuquerque, Las Vegas, Seattle, and the such. And then I've also worked on some gang assessments for Department of Homeland Security, USAID, and others. One was a 10-nation gang assessment throughout the Caribbean, which I have to say was a pleasure to take part in. And then also spent a substantial amount of time in Central America, working in Honduras and El Salvador, working on gang-related issues, including a gang assessment involving MS-13 transnational gangs up through DC and Los Angeles. And so, but today we're going to stay largely focused on gang assessments here in the United States. There will be a few examples shown from some other places because I think they provide some good examples, but largely we're going to draw upon some of these examples over the past 10 years from some case studies that I've been involved in. Don't hesitate to ask some questions, make some comments, but there is going to be a panel discussion at the end that I'm sure is going to answer many of your questions. So the issue that I like to start off with is why invest in a gang assessment. Most of the time when agencies or communities are beginning to respond to a gang problem, frankly, they just respond. They respond without necessarily really understanding the root and proximate causes. In other words, some of the long-standing factors that may be causing a problem to be a worse problem, or dealing with proximate issues, meaning some of the issues that the community is facing today. And what I mean by today, I mean literally as in today and the problems that can be taking place, whether it be within schools, neighborhoods, families, and the such. Next slide, please. And so what I'd like to be upfront about is I hope that many of you will take your responses to gang problems in considering your upfront diagnosis as important as you would your own family's diagnosis of their own health-related needs. When we go to a doctor, we don't just go to a doctor to tell us what we already know. We go to a doctor in the hopes that they're going to provide us with additional information so that when we decide, if we decide to respond to a health concern that we have, that we don't make the problem worse, or we don't address a problem that really doesn't exist. And so we go to the doctor, just like, well, why we engage in a gang assessment is because we want a correct diagnosis of our problem and the issues that take place. We want to avoid confusion. We want to be able to identify the problem as quickly as possible and as specifically as possible. We don't want an incorrect diagnosis because that can result in a number of things. One is it can be a waste of resources, but more importantly, it can sometimes make the problem worse. It can make the problem worse not only in terms of literally making a gang problem worse in terms of increased participation in gangs or gang joining or gang violence itself. And in turn, that can result in a loss of legitimacy for those that are involved in responding to the gang problem, loss of legitimacy for the community itself and others. So what we want to do to prevent a misdiagnosis is we want to assess the problem itself and be transparent about it. We want to take the data, and when I use the word data, for our talk today, what I'm really talking about is evidence. And evidence can come in a number of different forms, and that's what we're going to chat about today. Some of this evidence can be collected by what we might call generalists, right? That could be like our general practitioner, or doctor, or pediatrician that we take our kids to. But sometimes it calls for, when we get into more sophisticated types of evidence, that we need a specialist, right? In terms of understanding and how to engage in the analysis of evidence to make sure that we're understanding it accurately and we can really target the problem in a specific way. So when we talk about conducting an assessment, what we want to do is diagnose the problem, but just as importantly, we need to diagnose the capacity of the community to be able to respond to that problem that we've identified. Oftentimes, communities have a base level of capacity to respond to a problem, but depending upon the community and the resources that that community has, we may not have the types of capacity to respond to the specific problem that our community faces with respect to gangs. And we want to make sure that we're matched up appropriately, right? If we have a serious health problem, we aren't going to just simply continue to go to our general practitioner and hope that they have the equipment and tools and ability to respond to our significant health-related problem. But instead, when appropriate, we go to specialists because they have the ability to use very specific tools in responding to a diagnosis. And that's what we want to do in this particular case. In doing so, and as we go through the assessment process, we're oftentimes developing collaborative partnerships. We're identifying who's really needed to respond to the problem, who's important, who has key energy, or who has key resources to be able to respond to the issue. And then we're starting to engage those folks in strategic planning, even as when we're starting off in an assessment, because we're really understanding what it is that they believe their needs are, what their ideas of the problems are, and we're trying to get everybody in alignment so that we're all on the same page. And then it also provides us with a baseline of understanding to be able to hold ourselves accountable to determine whether or not we've made any difference in resolving the issues that we've identified. So in terms of the process for conducting a gang assessment, next slide, please. What we want to do is we want to think about this as a two-step process, because sometimes, not all the time, but sometimes an assessment can be done relatively quickly. And so we want to start off with a preliminary gang assessment. That preliminary gang assessment is really just a temperature check. It's an idea to determine one of three things. One is, do we even have gangs present in our community? Now, frankly, in most moderate to larger communities, having gangs is normal, right? We've known this for well over 100 years. The proportion of youth who join a gang anytime in their life is somewhere around 6% of all kids. I like to say plus or minus 4%, depending upon the problem within that community. But in some communities, we may not have a gang problem, or I should say we may not have gang members. If that's the case, we probably don't need any immediate action at that time. But if we identify that there are some gangs present, but perhaps the magnitude of the problems associated with violence are really not substantial, perhaps we want to be proactive in terms of prevention and perhaps intervention activities that don't need a substantial assessment, right? It may be relatively small in nature. We have the resources through conversations that we've had, and we can simply move forward. But if we know that gangs are present and the magnitude of the problem is sufficient enough to cause concern by the community, policymakers, others, we probably need to move into an advanced gang assessment. The purpose of the advanced gang assessment is, one, to target like a laser who, what, when, and where gangs are a problem, and two, identify with great specificity who our stakeholders are and what their capacity are to respond to our identified problem. Next slide, please. So as we go through this and we're trying to diagnose our gang problem, we can look at 8 different types of data. We sometimes call those, in fancy words, right, domains of data. Here, just think about it as different types of data. And I want to be very clear with you, we do not need to use all of these forms of data. What I'm going to be going through here is if the world was a perfect place and you have all the resources and you have all the personnel to help you engage in this assessment. That's not always the case. And so we're going to be going through all of these to give you some ideas. This is intended to be a start of a conversation for you to think about what an assessment look like if your community needs one. And this is really just to get you thinking about why different types of data might be important to your community. Next slide. We typically want to start off with community demographic data. This data can be typically collected through your planning department, whether that be at your town or city agencies. It can be focused on, you can also get that data online through the Census Department. One of the things that I oftentimes advise people to do is typically take about a 10-year snapshot on a number of key measures, things like, has your population changed? Do we have racial dynamics changing? Do we have a lot of transient population moving through? In other words, people moving in because of job-related reasons, or in some communities, as we've seen through the recent census releases, we've seen some communities losing people. That can also cause some problems that we want to be aware of. But here, what we're trying to do is get an overall global look at what's going on within our community and looking at where issues may or may not exist, just at a very 30,000-foot level. Next slide, please. And then what we can do is down the road, this isn't something we're going to be able to necessarily do right away, is we can start to layer this information with other data at a very basic level. This is an example of a project that we worked on in the Tri-Cities area in Washington. Smaller communities in one metropolitan area, Benton, Richland, and Franklin. And what you see here is that when we saw some risk factors present through the census data, we also saw that it was associated with either A, youth who were on probation, or B, youth who were on probation plus were members of the gang. And what we started to see was that while there were a few number of gang members on probation, we did see that those who were involved, juveniles who were involved in the criminal justice system, we could see that they largely lived in communities where a few risk factors might have been present, such as youth that are living in poorer communities, youth who are living in families of that are disadvantaged in one way or another, single parent households and the such. And we can start to use that information to think about not only root causes of gang membership, but also proximate causes of gang membership, such as renter communities and the such. But what we can also do is think about this in terms of how to leverage key stakeholders in our response to the problem. Next slide, please. We also want to make use of law enforcement data. Many of you might be already familiar with this data, especially obviously if you work within a law enforcement agency, but some of you might not be. One of the most simple forms of data is police reports, official police reports, data that I think can be some of the most important data, albeit it can be somewhat complicated to analyze, is your gang intelligence and your field interview cards. This data can really be valuable in terms of understanding who the police see, or from their perspective, their lane of sight, who they believe are involved in gangs, what proportion of the community they have documented in terms of gangs, what their characteristics look like. And then field interview cards, which I think are some of the best sources of data from law enforcement, provide great intelligence in terms of networks and who's hanging out with who. Within field interview cards, we get informal data from the police on who they happen to have contact with, and typically who they have stopped and who those people are with at that particular moment. So it gives you an idea of the social networks of those that the police are coming in contact with. And we're going to come back to this at the end of the presentation. Next slide, please. So when we're looking at official data, if your agency collects this data, we can oftentimes look at gang versus non-gang events. This can be done in very simple ways. It can also be done in more complex ways. But Compton had a fairly sophisticated RMS system, or records management system, for official data. It allowed us to look at official data where incidents that involved gang members versus those that did not. And this gave us a very quick snapshot in terms of, as you'll see here, that those who were involved in gang-related incidents were much more likely to be involved in felonies, much more likely to be involved in gun-involved incidents, less likely to be involved or at least arrested for property offenses, more likely to be involved in violence or person-oriented offenses. So right away, it tells us in Compton, at least from the police perspective, once again, this is only one perspective, but it tells us that gang members are involved in more serious offenses, more serious problems than non-gang members. Now, what I can tell you is this looks very different. If we had the time, I would show you what it would look like in an emerging gang city, such as Mesa, Arizona, where it showed that we did not have these kinds of differences. We did see that gang members were more likely to be arrested, more likely to be involved with the police, but not to this magnitude in terms of violence. And so this really helps us sort of pivot in a way to understand gang members' involvement in terms of the types of crime that they're involved in. Next slide, please. We can also map this data. Once again, this is an example from Compton where we conducted a gang assessment alongside with the National Gang Center, where we were mapping out where the gang homicides looked like, and throughout the report that you can find online, we layered this with all sorts of different data. But what we were able to do is identify hot spots where gang-related homicides were taking place. In other words, these gang homicides were not evenly distributed across the city. Instead, they were located primarily in a few census tracts, right? A small number of census tracts. And for example, if we were interested in participating in hotspot patrols or interventions, or even engaged in secondary forms of prevention, we might be able to focus those efforts in areas that we might consider hotspots for gang-related violence. Next slide, please. We can also look at student and school data. While we oftentimes have access to some of the more broader 30,000-foot level pieces of data, such as student characteristics, academic performance, oftentimes school disciplinary records and school perceptions, whether that be from teachers, staff, or the students themselves, can be excessively valuable. Next slide, please. One of the examples that I like to use is from some work that I've been doing in Arizona, where we were able to look at gang joining. Some of the things we oftentimes want to get involved in are prevention-related activities, but we really don't know where to start. So we oftentimes just provide broad educational information, but it can sometimes be very helpful to target the populations that we're focused on. So for example, here in Arizona, where we have a very large Native American community compared to others, what we saw was that reasons for gang joining among youth in school, once again, not that left school, but are actually in school who took this survey, we can see that they were more concerned about joining a gang for issues of personal security or protection than, for example, African Americans that were much more likely to join a gang to make money, largely related to small-scale drug sales. But what you can also see is they have some common things in interest, which we know from national level studies, is that many people join gangs for friendship. Right? That's something that both groups had in common. So when we're focused on prevention activities, one is we can create a general curriculum based on some of our assessment activities, right? People are doing it for friendship, socialization, and the such, but we may want to target some of our discussion on prevention efforts based upon specific populations. And a gang assessment can really help target the messaging that we want to get across. Next slide, please. This is a slide from some work that I did in a country called Trinidad and Tobago. They're right off the coast of Venezuela. They have a gang problem that is substantially worse than the community I live in Phoenix. We were diagnosing various issues of violence and gangs among the 20 most problematic schools there. One of the common things we found there was that we had the same problem students, what we might call repeat offenders. And what we found was in a typical, or in one year at one school, this is just an example, there were roughly 104 behavioral violations within the school that were written up. But what we found was that were less than 20 youth that were involved in half of those incidents. Once the principal, once the teachers identified this issue, they were divided up in a small problem-solving units for each school. They realized, geez, this problem is much more manageable than we ever would have thought. We were responding to the entire school. We were responding to more than 100 students, but instead they realized, geez, we could really focus on these roughly 20 kids and have a much more significant impact than spreading our resources out to the entire school, or even to just all of those kids who got into a little bit of trouble. And they recognized that they could devote a substantial amount of resources to those 20 kids. It really helped them focus their resources on what they later learned to be a really small number of youth that were engaged in the majority of their problems, which in this case were largely related to fights and gambling and a little bit of drug work. Next slide, please. We can also look at community perception data. This can be stakeholder surveys. This can be related to, we can hold focus groups, talk to neighborhood associations. Next slide. It can also be used to take a look at, we can use surveys, I should say, that can help us look not only at how substantial the gang problem is from the citizens' perspective, but also from the perspective of their views about the criminal justice system and their response. Now, in this case, it was from data from Mesa. We had a number of stakeholders that stated verbally that they believed that they had a substantial gang problem. This gang problem was getting worse. We engaged in a citizen survey that was sponsored by Motorola Corporation, where we were able to engage in a telephone survey. And what we found was that roughly half of citizens in these neighborhoods that were identified as potentially problematic did believe or were at least somewhat worried about a gang problem within their communities. Roughly 10% were very worried about the problem. Next slide. One of the issues that we heard from some of the stakeholders was that there were problems with the police, that the police were being too aggressive with youth, being too aggressive with residents. We ended up polling basically the citizens in these very communities where they articulated that they had a gang problem. And what we found was the broader set of citizens did not share that perception. They thought that the police were trustworthy, treated people fairly, they were respectful. It allowed the police organization not only to pivot from what they thought might have been some issues related to their officers, which quite frankly, there may have been a few, but it was not as substantial as some people thought. And they were actually, the police were well thought of in this community, and they were able to use them as part of a comprehensive approach to gangs in the form of outreach, greater intelligence collecting, because they were perceived as relatively positive by most of those in the community. So it gave them an additional tool that at first some people believed just wasn't going to work out. Next slide, please. The type of data that I personally believe are some of the most informative are those where you're interviewing gang members themselves. This is something I try to do for every project that I engage in. We want to look at the motivation for gang joining. We want to look at their level of criminality compared to non-gang members, risk factors that may influence gang joining. And then we also want to look at their motives for leaving the gang and joining the gang. Next slide. So this is an example of a survey. We did a long-standing survey in Maricopa County and Phoenix specifically. While we were in Compton, we interviewed recently booked arrestees as well. We did not use exactly the same questions, but pretty darn close. When I said that Phoenix has a modest gang problem compared to Compton, I think this is a really good example. Both of these looked at arrestees or those who had been booked within 48 hours of their arrest. And what you can see here is, in terms of current affiliation, in Phoenix, roughly only 5% of those adults who had been recently booked or arrested stated that they were currently affiliated with a gang, whereas in Compton, it was closer to 50%. Really suggests a very different type of gang problem and very different responses that are needed to address that community's problems with violence and crime in general. In Phoenix, a small part of their problem related to violence and crime is related to gangs. In Compton, we see that it makes up a substantial proportion of those individuals who are involved in crime, or at least who had contact with the police and who were arrested. Next slide, please. We also can look at why some of these individuals left the gang. This is once again an example from Phoenix. What I like to discuss is that we really see different reasons why people leave the gang based on the community. And this is why I think it's important. It's also important to inform our expectations about prevention and intervention efforts. For example, here in Phoenix, most of the people don't leave the gang because they went to jail or prison. In other words, we're not going to enforce our way out of the problem in terms of getting people to leave the gang. Instead, what we know in Phoenix, or what we think we know, is that most people leave the gang for very personal reasons. They got tired of it. They started a family. Perhaps their spouse was not interested in them being involved in a gang anymore. Or maybe they don't have a spouse, but now they have kids and they feel greater responsibility for these youth. We also saw some individuals were interested in leaving the gang to avoid violence. They had seen friends of theirs who had been the victim of violence, and they wanted to avoid them themselves. And so, in other words, it's providing us with some information about perhaps when key opportunities for intervention exist. So when we're filling out our broader framework for understanding how to address gangs, and we're dealing with our expectations about what different strategies we need to employ to deal with different aspects of the problem, we can think these through with information obtained from gang members themselves. Now, what I wanted to, in terms of the analysis side of the problem, I wanted to sort of end with a note on social network analysis. Social network analysis now is becoming more and more popular every year. It's to the point now where some crime analysts now have the capacity to engage in social network analysis. Social network analysis is sort of a amped up version of link analysis for law enforcement officers that are out there, where it allows you to understand the center of gravity of either individuals or groups or gangs that are involved in violence. It allows us to understand who has connections with who. In Glendale, for example, when we engaged in some social network analysis looking at field interview cards, gang intelligence, and some violence data, what we found there was that the gang problem was not gang-based or set-based, but was really a hybrid problem. The individuals who were most likely to be involved in gang violence were actually individuals who were members of a gang or a set, but they actually hung out with youth from another gang. So in other words, you had literally Crips, Bloods, others that hung out together. And these were the individuals who were primarily involved in generating violence and crime within this particular community. So it gave us the idea that we shouldn't be just focusing on a particular set, but we need to be focusing on those folks that are much more embedded into a criminal network. Next slide, please. And then this is an example of Compton. What you can do is you can take a look at gangs. You can try to identify in Compton, it's much more set-based. And what we found was that we can really find the center of gravity of particular gangs. Not all gangs were at equal probability of either being an offender or generating the violence in terms of being the perpetrators or the victims of violence. And so what we found was rather there were a relatively small number of gangs that were involved in perpetuating or the victims of violence. And it gives us a little bit better idea of where to direct our energy. Next slide, please. Now, next slide, please. What I didn't get too much into, and we just simply don't have the time, is what we can do is link up the problems that we've identified within our communities, and then we can generate or focus our efforts to specific types of youth. So for example, if we have youth and we've identified those youth are at high risk for gang joining, right? We want to aim and we want to focus and use secondary prevention strategies to address those youth. If we have youth who are already involved in a gang, we perhaps want to use very specific forms of of gang interventions to address those youth, perhaps to pull them out of the gang, or at least to engage in harm reduction activities to hopefully dissuade them from engaging in retaliatory violence. And then we have those who are chronic offenders, gang leaders, serious offenders, those that are beyond the point of prevention and intervention activities where we need to focus our targeted enforcement efforts and imprison these individuals for the safety of the neighborhood. Next slide, please. Now, before we get to some of that, and while we're engaged in our gang assessment, I want to make sure you're aware of a great resource provided by the Gang Center, and that is a community resource inventory. It's something I use as part of my gang assessments. It is super easy to use, and it makes sure that you have a great idea about what is going on in terms of your capacity to respond to gangs in your community. It helps you identify the agencies that are out there, lets you know what age, the types of people that they work with. Are they focused on both genders? Are they just focused on females? It also gives you an idea of what you're missing. It does a really nice job of allowing you to lay out which agencies are already working with gangs, the types of gang members they work with, what it is that they do with gang members. Are they prevention, intervention, suppression? Do they focus on specific neighborhoods or communities, or are they more broad-based? And it allows you to figure out and take inventory of what you have and what it is that you need to generate, perhaps applying for grants, perhaps your community can afford to slightly pivot resources to address those issues. And so that inventory guide, I think, is just simply indispensable in terms of any assessment towards dealing with gangs. Next slide, please. So if you would like more information on assessing your gang problems, please don't hesitate to go to the Gang Center's website. They have a very comprehensive guide, much more of a comprehensive guide than what I can provide you in this 35-minute period that I've been speaking. And it will help take you through a number of these issues that I've talked about to give you some more specific information. And so just to conclude, when we're conducting a systematic gang assessment, right, we first want to diagnose the problem, and simultaneously, we want to diagnose our community's ability to respond to the gang problem that if it exists, to that problem that we've identified, right, in terms of prevention resources, intervention resources, and suppression resources, right? We want to establish collaborative partnerships. We want to be able to get everybody on the same page with the same goals, make sure that we're like-minded in terms of what our priorities are, so that when we're seeking resources, everybody can be on the same page and understand what it is that's expected of them. And as we're doing that, we're engaged in a strategic planning process. Right? We want to focus on the most serious problems first, right? We want to target the resources that we have as specifically as possible and make sure that we develop those, develop the capacity to respond to problems that we don't currently have the resources to respond to. Right? So as part of our strategic planning, we're literally filling in the gaps. Many communities have suppression resources, at least at their base level. Many communities, however, don't have resources or capacity to intervene in current crises, retaliatory shootings. And in some communities, they don't have prevention resources, such as the Gang Resistance Education and Training Program, a best practices for gang prevention, right? A program that's relatively easy to get up and going, something that also the National Gang Center participates in. And then we also, our assessment helps us set baseline for holding ourselves accountable, right? In terms of letting us know when we set up our strategic plan, when we expect certain things to be done. We all know that some agencies are, quite frankly, much faster, much more nimble at responding to problems than others. And we need a means of saying, you said you were willing to do this. Have you gotten it done? Did you get it done in the time period that you said you were going to do it in? And then we can use this information to help us understand whether or not we've had an impact on the problem. So with that, I'm going to go ahead and turn it back over to Mina next. Thank you.
There we go. Well, thank you, Dr. Katz. We have some questions coming from the attendees that we will pull in and address, just a couple of questions while we do this panel discussion. And so please stay on and participate in this panel discussion as well. So let's get our discussion started. I want to introduce Ms. Miranda Eccles and Mr. Jeremy Biddle. And Miranda currently serves as the Community Resources Coordinator for Newport News, Virginia Police Department's Community and Youth Outreach Division. This division focuses on creating working relationships between the community and law enforcement and offers various community education programs. Previously, she was a youth gang violence prevention manager for the Office of the City Manager in Newport News. And Jeremy serves as special advisor on the group violence reduction strategy to the mayor and police commissioner in Baltimore City, Maryland. He was formerly the senior advisor to the mayor's office of neighborhood safety and engagement on gun violence prevention, where he provided leadership on partnership-based data-driven strategies and interventions to reduce gun violence. So Jeremy, let's go to the questions. Thank you. So Jeremy, tell us a little bit more about your current initiative in Baltimore and describe the process for conducting a gang assessment or an assessment, a violence assessment in the city.
Good afternoon, everyone. It's a pleasure to join this panel. As Mina said, my name is Jeremy Biddle. I'm a special advisor for the group violence reduction strategy in Baltimore City. And coincidentally, we actually just recently finished doing our own problem analysis of serious violence in the city's Western Police District. And I can explain in some detail, and I'll keep it relatively brief, just give an overview, the process and methodology that we used under the scientific leadership of Dr. Anthony Braga. We first conducted a quantitative portion of the assessment in which we really tried to understand the profile of those most directly impacted by gun violence, homicide and non-fatal shooting victims, suspects, and persons of interest, to see their age, race, sex, and criminal justice contact, both the breadth of it, the kinds of offenses, and the depth of it, all through incarceration. After that, we looked at, we did what's called a homicide incident review, where we reviewed 69 victim cases to tease out motives. So this involved meeting directly with the homicide detectives, the primary detectives that were leading the cases, to understand motive and also connections with group dynamics or gang dynamics. After that, we conducted what's called a group audit by engaging with frontline intervention workers and law enforcement to understand what groups were present, what can we learn about them, what kind of illicit activities were they engaged in, and what were their ties to violence. And we rounded out the work that we did with some social network analysis of one specific group, in which we were able to actually establish that just by virtue of being a part of a high-risk network, an individual is at a 1,700% higher risk of gun violence victimization than an average Western District resident. So all of this data, this information that we were able to gather has been extremely useful and productive in helping us design a strategy fit for Baltimore that meets the capacity and resource constraints of the city. And we're in the advanced planning process now before implementation, which we hope to start early in 2022.
Thank you. Thank you. And if there are questions from the attendees, please put them in the chat and we will get to as many as we can. So Miranda, Newport News is a little bit different than Baltimore City. The context is different. So tell us your experience with the process for conducting a gang assessment during your period or during your time as a coordinator for that initiative.
So certainly, as you said, the context and the way we went about our assessment was really different, totally different than the way they did it in Maryland, and even the way that Dr. Katz explained it. And so what we did, we started off with just a really brief analysis and just looked at what the gang problem looked like in Newport News. And that started with going through a lot of our police data to see who were documented as gang members, to see where crime took place, to see where the highest concentration was, to see even whether or not to define whether or not we had a gang problem. Because, you know, I saw in some of the Q&As that came up, and Dr. Katz even mentioned it, part of your assessment will let you know whether or not you in fact have a gang problem. And gangs can look really different in everybody's community. And I know for us in Newport News, which is in the state of Virginia, the term gang itself is defined by our legislation. And so we had to make sure that before we were even classifying people as gang members, that they actually fit the legal definition of a gang. And so we looked at that data. We looked at some community data in terms of see what the community around the highest concentration of crime, because what we found is that just by statute of definition, we didn't necessarily have a documented gang problem, like, you know, when you think about your Bloods and your Crips and things of that nature, but we had young people in our community who were certainly operating as gangs. And so instead of looking at a gang problem, we kind of shifted to the highest concentration of violence and where it resided in our city and what was going on around there. What was the poverty level like? What was the education like? What was the community retaliation like? What was the community support like? And then from that data, that's how we determine where we would get started in our community engagement process. So determining who we would serve, determining what our community resources look like in that particular area, determining who some of our community partners could be, determining who would serve on our steering committee to help us guide the work. And so that's the data that we use to initially get us started in our process. And then a few years later, we did backtrack, and then we did some community interviews with actually members of the community. We did some focus groups. We did some focus groups in schools. We did some focus groups in our religious communities. We did some focus groups with members who were a part of our steering committee. We did focus group with young people who were in our juvenile justice system as well as our local jail. We did interviews with our elected officials, really like everybody who touched this problem and everybody who needed to be a part of the solution. We went back and did those focus interviews and then kind of used that data to help us propel the work forward.
So what you explained sort of leads us into our next question, and that is some of the challenges that you encountered while working through this. It was a long process.
Yes.
Newport News is not as, you know, a big metropolitan urban area the way Baltimore or other urban areas are. Yes. What were some of the challenges that you encountered during this process?
So the first thing I will say is, if possible, do not follow the process that we did, because the advice that Dr. Katz gave in starting your engagement with this community assessment is extremely important. And so for us, the reason why that did not happen, our former administration, so it's important to say that our city manager who we have now, our police chief that we have now, and some of our local leaders were not the same leaders that we started this project with. And so those that we started the project with kind of felt like, well, we know we have a gang problem in Newport News and we already know what it looks like. And so we're not going to waste the time to do an in-depth assessment because we want to just get started. Well, believing what you think you have and actually knowing what you have and being able to support what you know with the data is two totally different things. And so the challenges that we had is that we went off, while we had some data, you know, we just didn't start blindly. While we had some data to guide the work, we did not have the in-depth level of data that we needed to really propel this project forward and to keep us going. And then for us, one of the things that we said we were going to do in our initial assessment was that we were going to start in one small pocket of the city, which, as I said earlier, had the highest concentration of violent crime. And we were going to stay in that area for maybe 2 to 3 years, get our data together, get our feet wet, have some what's the word I'm looking for? Have some success stories, you know, to be able to prove the work that we're doing and then expand out broader. Well, sometimes what happens when you're doing a good thing is everybody wants to be a part of that good thing, right? So because we did not have this thorough documented community assessment to guide us, what we noticed started happening is that some of our elected officials started asking questions where I see what you're doing in this particular community, and I hear from the community that you're doing good work, and I hear that your outreach workers are out in the streets, and I hear from even some of our law enforcement partners that you all are really kind of helping to attack this problem. Why aren't you doing this work in our district? Why aren't you doing this work across the city? Well, without that documented, thorough assessment that says, here's where we need to stay, here is why we needed to stay it, we got caught in political pressure. And so instead of us being able to stay where we wanted to stay for 3 years, because I really think it's important that you start small and then build yourself out, because it's so hard to go large and then come back in. And so without that assessment, we really didn't have the teeth to be able to combat some of our elected officials who was paying for our plan. So let me say that we did not start our program with any grants or any outside funding. It was specifically funded by our local dollars. So we needed our elected officials, we needed their stamp of approval so we can continue to get the funding. So without that documented assessment to really guide the work, we didn't have the teeth to really fight them and say, well, I won't say fight, come back them and say, this is where we need to stay and this is why we're staying there. And even for some of the response for the community, why you're not working with this person and why you're not working with this person, that assessment, like if you have this document in your hand and it's research-based and it's thorough, any questions that somebody asks you, you really have the opportunity to be able to present it to them and say, here's the thorough assessment that we did. Here's why we're doing it. Here's the partners that we have. Here's why we're serving it. And it keeps you from going to and fro. And so we spend a lot of time, I think, just kind of going back and forth and fighting battles that we would not have had to fight had we started with this assessment to guide the work versus picking it back up maybe 2-3 years later when we had already been doing some work, but it wasn't the best work that we could have been doing had we started with this assessment.
So your comments are spot on, because it's about the data helps focus the issue. The data helps drive the strategy. Yes. Jeremy, how about in the work that you've been involved in Baltimore and the challenges similar or challenges specific to Baltimore that you have seen and what you could advice or hearsay or hindsight that you could also provide our audience?
Absolutely. I think and this has already been kind of mentioned, but part of the challenge is urging patience, right? Doing this kind of analysis will take some time, but it's best to understand the problem as it actually exists than to just listen to the prevailing narratives and myths. So we busted quite a few myths through this analysis. We found out that the average age of a homicide or shooting victim or perpetrator is much older than public perception would lead you to believe. A lot of news media coverage covers juvenile gun violence, but we also have a very serious adult gun violence issue in Baltimore City. The average age is between 30 and 32. We also found out that drug markets and economic motives do account for some of the violence, but not nearly as much as people would believe. A lot of the proximate causes or triggers of shootings seems to be petty disputes, issues of disrespect, Instagram feuds that spill out onto the streets. We also found out that over 50% of the incidents that we reviewed were retaliatory in nature, involving groups and group members. And finally, the biggest takeaway that I think was extremely helpful was, we talk about having this big insurmountable problem. Where do we start? Well, we were able to establish that a very small percentage of the population was associated with up to 70% of the gun violence. So clearly, from a prevention intervention perspective, that is the population we need to be intervening with if we're going to reduce gun violence in the short term. In terms of challenges, so obviously there are political pressures. Everyone wants to get to go. Law enforcement partners are, as Dr. Katz said, the well-equipped, best equipped, and the most ready to just jump into action. But we had to urge patience. We had to build the infrastructure. We also, just getting access to data, mundane things like starting the analysis also took far more time than people would have liked in an ideal world, given the state criminal procedure code and the criminal history record information barriers, because we relied a lot on law enforcement data and law enforcement intelligence to do this analysis. And it's something we're going to rely on a continuous basis. And lastly, I would just say these kinds of analyses are not just, some, quant sitting behind the computer or crunching numbers. A lot of it's qualitative. It involves focus groups and interviews and takes up a lot of people's time. So, we didn't do one group audit for the Western District. We did 8. We took up a lot of their staff time, and it was important that we circled back and prioritized giving them the results of the analysis first and foremost, so they can see the fruits of their labor.
Thank you. Thank you. And so as you've been speaking, we've been receiving questions around the resources it takes to conduct these types of assessments. And as Dr. Katz had said earlier, it's not about what he laid out was like the ideal, and it's not about all, having to do all of this. So Dr. Katz, one specific question, are there any common challenges rural or smaller communities come up against when conducting a gang assessment compared to larger urban areas? And if yes, what do you recommend these communities can do to overcome those challenges?
Yeah, that's, I think, an excellent question, because there's a major difference in conducting an assessment in more rural, smaller communities than in communities where there are already substantial resources being used to generate information, intelligence, and the such. My experience has been in smaller communities, believe it or not, is start to talk to the youth themselves. It's relatively infrequent, it's quick. You're oftentimes better off going with somebody who's relatively independent, but you can be conducting surveys in schools to get a real quick feel of what's going on. I think going into and speaking to youth who may be in detention from your community, whether they're still residing in your community or not, speaking to those people. And as Jeremy said, conducting focus groups and getting out there and speaking to those who you believe where the problem exists is a really quick way of collecting information and getting out there. It doesn't have to be bringing together all this, as Jeremy said, quantitative data, but just starting off in very simple terms with debriefs with the youth who you think are problematic and what's going on there, talking to school counselors.
Yeah. So what you're saying is that, because you don't have, you feel like you don't have the resources to get started, you can. There's always a place to start, and there's no prescriptive way of you have to step 1, step 2, in the sense of the data that you're reaching out and collecting and the information that you're finding. And,
absolutely.
Yeah, correct. Okay, so our next question is, how do you anticipate that the assessment will help or would have helped you build an effective response? And Miranda, I'll start with you.
So I think that I can't stress the importance enough that the assessment will help guide your work. So instead of just throwing darts at a dartboard and hoping something stick, if you have your plan that is backed up by your assessment, you know exactly where you're going, you know what you want to accomplish, and you have this roadmap to help you get there. And I think another thing that we found is that the assessment helped us identify some gaps. It helped us identify some gaps that we had, in our local area to help serve young people. So like, for instance, if we say that we wanted to have a gang intervention program and we wanted to be able to provide resources for young people who want to transition out of gangs, but all of our community partners, or the majority of our community partners, as soon as they hear the word gang, they automatically say, I don't want to serve them. I don't want to work with that population. how are you going to get them help? You know, because not every young person involved in the gang wants to stay in the gang. For some of them, they just feel like there is no other way out. For some of them, it's generational, it's all they know. And so it helped us to identify the resources that we had. And it also helped us to identify the resources that we did not have. It also provided that educational tool that we would need for the community, because again, not everybody understands what a gang issue is. Not everybody understands what a gang problem is. Not everybody understands the importance of intervention. And so when you have this assessment, it gives you the ability to be able to not only answer those questions, but also how you plan to address those questions. And certainly for your financial partners, whether it's coming from a grant or whether it's coming from your local authority, it gives you an opportunity to be able to respond to them. And so let's say they gave you hundreds of thousands of dollars, right, to be able to combat this gang problem. And then 6 months later or a year later, they say, hey, what have you done with this money, right? So the assessment will give you this roadmap to be able to track your progress, to be able to say, here are the goals that we laid out. Here is how we are attacking those goals. Here's those areas that we still find need for improvement. Here's those areas that we excelled on. And even here's those areas that we never identified initially, but as we were doing the work, they came up and we realized that it was a more common problem than they thought we had. And so the assessment, it gives you that roadmap. That's the word that I like to use. It gives you that roadmap to be able to respond, to be able to act, and to be able to be sustainable.
And be able to bring together consensus.
Yes.
Of all partners, right? And you bring up a really good point, and I want to take this over to Jeremy as well, because that data, that roadmap, it helps bust some of the perceptions and the misperceptions. So Jeremy, how would you answer this question about how the assessment is helping to build an effective response in the area of Baltimore that you're addressing?
Yeah, it's a wonderful question. I think it really helps create that baseline understanding of what the problem is, which is an important first step in building an effective response. I think one of the big takeaways was we saw from the analysis, and this is really not that surprising because it's kind of pretty common in a lot of jurisdictions, there was a very strong overlap between victim and offender populations. We're talking about people with very substantial criminal justice involvement, many of which have been former gun violence victims. And really what it does is make us stop and pause and think about how do we build an effective infrastructure around this high-risk population and high barrier population that's disenfranchised from a lot of different support and service resources amongst our criminal justice partners on the one hand, and our community and service provider partners on the other. And one big takeaway, one big outcome of the assessment was we found out, as I've mentioned, that the population most directly impacted by gun violence is older in age. There is no service provider at the moment in Baltimore City providing services and wraparound supports to men over the age of 25. So what was the first thing we did? We made a program to serve men over the age of 25. That was absolutely critical. Almost 70% of gun violence victims are over the age of 25 in Baltimore. So that was a big, tremendously big first step. We also used the assessment to help us think about how to create a dedicated unit within the Baltimore Police Department. It's called the Group Violence Unit. It consists of proactive group-based investigative teams, enforcement teams, and also outreach teams. And that has been, we've been in the process of screening and hiring, and again, putting in personnel requests to staff the unit. It's going to be about 50 officers strong. So it's going to have a lot of dedicated muscle behind it. And we're trying to make sure that the officers in the unit are the officers that will engage in a procedurally just way with this high-risk population, because this population, I really do believe it's the spearhead for reform in police community relations, right? This is a population that is the least that trusts law enforcement the least, yet needs protection the most. So if we're talking about building that bridge between personal and public safety, it starts with this high-risk population, and we need officers that believe in the humanity of this population and can engage with them in that kind of way. It's also, I would say, the assessment's been helpful in making people understand that this is not flipping a switch. This is not overnight work that we can do from one day to the other, but promoting real systems change. Partners have to work together differently within sectors, across sectors. It's really, really hard work. We're just not used to doing this kind of work as we're set up in a system right now. So just kind of urging some patience and time to allow ourselves to do this and do it well, rather than just jumping straight into action and floundering as we always tend to do. And last thing I would mention is properly investing in impact and sustainability, building dedicated management teams that can actually have the resources to do this work effectively, making sure there's sustained political will and that there's fidelity to implementation. And also, an evaluation component. I believe strongly that just as we need to use an evidence lens to diagnose the problem, we have to use an evidence lens to make sure that we're addressing it effectively.
Mm-hmm, mm-hmm. Yeah, those are outstanding points for all of this work, and you took it out broader. This webinar is we're focusing on the assessment, but you're absolutely right, because it starts here, and it's the building block for getting to that implementation, those strategies, filling those gaps, and sustaining, getting the political will and sustaining these. And I like that you're also coming back constantly to the patience. We need the patience, because this is hard work, and it takes a long time. And we recognize, I know that the federal government often has 3-year grant funding cycles, but they recognize completely that, it takes longer. We know that it takes at least 3 years to get something up and started, and then longer to build those sustainable, not just programs, but the systems changes and the collaborations. So that's good. We're getting a lot of questions. I want to thank you all for those questions. For answering, for your input. We're getting a lot of questions around the issue of measuring the defining gang, measuring gangs. As I opened in my statement, there's no universal consensus around defining gang. The research literature, there's huge discourse in that. There's across the country, some, communities are trying to do something about the violence. Some recognize it as gang violence, some recognize it as group violence. Dr. Katz, I'm going to read one question here that gets at that defining a gang, defining, how do you define a gang-related incident? If a police department does not currently have a process for differentiating between gang and non-gang incidents and arrests, how do you help them put that in place? What gang definition should they use? What challenges should we expect in helping them in this place? So that gets at that specific question, but this larger challenge of the definitions. So if you want to take a shot at that, go ahead.
Yeah, it is a complicated issue, and don't think that you're by yourself and you're missing out on something, because this is something that a lot of different communities deal with initially until they determine which course they want to move in. But you want to start off first with understanding any state statutes that you might have, understanding what, if the state has a definition or your community has a definition legally of what a gang is and what that means for your community. Are there any existing, and sometimes agencies forget that they had a policy, but they can have a policy on what it means to document somebody or a crime as gang related or gang motivated. So first, do a little bit of homework just to double check whether or not any of that information may exist or may not. After that, you need to think about what's going to be most important to your community and how to deal with identifying which crimes may be gang related or motivated or not. There is no one right way to do it. Now, with that said, what I would suggest is you start with the most serious incidents that take place in your community. If that's homicide, start off with going through the homicides and identifying whether or not they were gang related or gang motivated. And I'll get to what that means in a second. And you can also go through other serious forms of crimes. I typically start with homicides and then work down to assaults and others. And in doing so, if your agency does not have a definition, you can at least create an informal one. Most of those definitions involve one of two different strategies. One can be a gang motivated definition, and that's in furtherance of the group or the gang that criminal activity took place on behalf. Or you can go with a gang-related definition, meaning that somebody who was a documented gang member was either the suspect or offender or is the victim of the incident. I personally don't think it makes that much difference which definition you have, but rather think about the resources that you have available to you and what it is that you can do. Just know if you go with a gang-related definition, we more or less make the assumption that gang-related definitions are going to produce about twice the number of results that a gang-motivated definition uses. Either one is adequate. Don't think that one approach is better than the other. Gang-related definitions, I think, can be very handy if your community has a gang intelligence database. But if you don't have a definition, I'm assuming you don't have a database. But if you do have a database, it can be helpful, and you can just look at the names on the database with those who are victims or offenders in incidents, and then you can start to calculate what proportion of different crime types are gang related. We can talk more about that offline, but there's a series of steps, all of which oftentimes generate into an enormous amount of discussion, but really don't get caught up in any particular one method.
Right. Don't get caught up in that, because remember, it's the violence, and it's that's happening that we have to address, and the outcomes and the very significant outcomes of that violence that we're all trying to address. So with that, there are more questions around that and measurement, but I do see some questions coming in around the cost of this assessment, and that is always a question, and then we can address this at the Gang Center, because we talk about this also with people. But Jeremy, talk about, because Baltimore would be considered resource rich and all of this, so considering when some of our attendees are coming from smaller, more rural areas in that sense, but not so, there is an investment in funds, but some of this is in-kind work as well. So if you could talk about how important it is to build those partnerships for that, and then get that data information going, and data information sharing, and where it's appropriate, and those types. That systems change also that you were talking about, so that it's not just a matter of an outsider coming in, you pay for an assessment and you move on, but there's more to it than that, than when we think about cost of an assessment.
Yeah, absolutely. So I would not consider Baltimore a research-rich environment, resource-rich. I wish we were more resource-rich. We're very grateful for the ARPA funding that the city's gotten, because we just announced a couple of days ago that $50 million over 4 years is going to go towards violence prevention and intervention, which is pretty transformational for a city that's not has a shrinking tax base and a shrinking population and a lot of perennial challenges. So we're very grateful for that. For this work in particular, we built a technical assistance team. I am kind of on it. I am a city employee, but I am also very plugged in with the technical assistance team led by Dr. Braga. We were able to raise philanthropic funds to be able to fund the assessment. I can't, off the top of my head, tease out what the assessment alone costs because it's built into a larger budget for a lot of different forms of support, peer support. We're partnering very closely with the California Partnership for Safe Communities, for example, and some of the folks that were involved in Oakland ceasefire and other kinds of supports. But I would say that, you know, there are so many different ways to approach these kinds of analyses. You don't need all of the bells and whistles. A lot of it really starts with the interest and the commitment and the discipline. I will say those three things. And a research partner. I think ideally you'll have a research partner who can bring a lot of added value. Of course, that means you'll have to navigate the data challenges, but they're all surmountable, right? We were very creative in how we did it, and I'll be very frank. There's a very complicated multi-year-long state process for research partners and evaluators to get criminal history record information, or there's a contractual arrangement, which means you get to go really a lot faster. So that's what we ended up doing. So again, I would just, you know, urge people to think creatively about how to problem solve to get this work going sooner rather than later. And also don't be deterred or don't be demoralized by or think that it has to be, you know, a big grand endeavor that involves, you know, celebrity academics like Dr. Braga or whomever. I mean, local university partners, especially if they have criminal justice programs or criminology programs, will have, you know, prime material, people that are, you know, students and professors that might be interested in supporting in this kind of effort. And it really just takes the interest to get things going.
Thank you. Thank you. Yes, and I like what you don't be deterred. That's what you said. So for those who are trying to figure out how to pull off an assessment, right? Don't be deterred and don't think it has to be, you know, so big, so huge. Start somewhere. We have about just a little less than 15 minutes left, and I think we have enough time for one more question. Do we? If Sterling could tell me yes or no.
Yes, we have some time to take additional questions, Mina.
Okay, thank you. So Miranda, before we, you know, move on to some of these other questions, in listening to some of the challenges and it seems so overwhelming, these assessments, do you have any comments you would like to make on this last question?
I think Jeremy and Dr. Katz have both hit the nail on the head, and even the comment that you made, and don't feel like your assessment has to look like another community's assessment, because every community is different, you know. So as long as you have something to get you started, like you can always build and you can always add to it. There's nothing wrong with researching what other communities have done to see what their assessments look like, and then figure out what's going to work with your community, and figure out what resources and what partners that you already have in your community, and use those to be able to get you started. And even for some of the comments that I saw that came up in the chat, I think, you know, one of the most important things to remember is that your assessment, again, is going to help you guide the work. You know, I saw a lot of comments about some areas feeling like their community don't necessarily understand what a gang is, or what the gang definition is, or what a gang problem is. And as Dr. Katz said, if you start your work by defining what a gang member looks like in your community, that's going to be able to answer the questions, because we dealt with the same thing. Excuse me, we don't have a lot of the national gangs, you know, like your Bloods and your Crips and your Latin Kings, those names that ring bells. And so we heard people say, you know, well, because you don't have that, you don't have a gang problem in your community. And so we were able to educate them, you know, by the statute of Virginia and by the data that we've gotten from the Newport News Police Department. Here's what gang looks like in Newport News. It's a lot of neighborhood-based cliques. You know, it's a lot of jumping from this neighborhood to that neighborhood and blending with this neighborhood and blending that neighborhood. And one day you repping this set and another day you repping another set, but being able to define what it looks like for your community and not necessarily getting caught up on the name. Like, don't get caught up on we don't have bloods, but get caught up on what is the activity that's happening. What violence are they doing? What crimes are they committing? What does the engagement look like? So being able to define those things in your assessment, that's really what's going to be important. And again, I just can't say enough, understanding that every community is different. So don't get caught up like a larger city like Baltimore. The issues that we have in Newport News look nothing like what Baltimore has. I look at some of the numbers that Baltimore have and my mind is spinning. Like I just can't wrap my head around it. So an assessment for Newport News will look totally different from an assessment in Baltimore, but it doesn't mean that it's not thorough. It doesn't mean that it's not guiding the work. So make sure that you stick to what's necessary for your community, what your community needs, what your community look like, and make sure that your assessment speaks to those things.
I think that's an outstanding answer. And also really, I want to reiterate, don't get caught up in these labels of national gang, this national gang or this clique or crew. It really is about what's going on in your community and the activities that are driving the violence or creating the issues in your community. We just received a question. Do you include lack of services to teens, poverty level, high school dropout rate, lack of employment, etc., in your assessment? And Dr. Katz, I'll turn that over to you, just so that we're not specifically on a specific assessment, but just in general, including these kinds of this kind of information in an assessment.
Almost always, especially in terms of where those particular issues are geographically problematic, so that you can better target needed services. So if in your community, one of the reasons youth state that they join a gang is for money, or if they state that it has to do with educational issues that they're confronting, maybe they dropped out and they're looking for a GRE to get back into the job force. Maybe they're looking for, it can come down to some pretty sophisticated targeting of resources toward very specific problems. And that's exactly why, in a perfect world, that you are looking at those things. Now, once again, what Mina is drum that she is beating on, I think is the right drum, that you need to make sure that this is right for your community and it's a right fit, and don't make perfection the enemy of the good. And so while I'll say, yes, absolutely all those things are needed. And as a matter of fact, there are some of the cheapest forms of assessment that can be done, because most of the types of data that you're collecting already exist within communities down to a fairly small level. The problem can be identifying the right people to analyze that data, but typically they already exist within your government services, whether that be town, city, or county, that can help with those sorts of issues. But don't get overwhelmed. Create a priority list and start just knocking down at it. But absolutely, those are very important issues to be focused on.
Thank you. Thank you. So I see we've got about 8 minutes left, and I want to make sure that we have time. We did to wrap up. There are more questions that come in, and if we didn't address your questions, please reach out to us, and we can continue. Oh, Sterling says we have time for one more question. So why don't I just do wrap up thoughts? And Jeremy, do you want to do any kind of last piece of advice for anybody out there who's really interested in this topic and this work and what you're doing?
Yeah, absolutely. I would say, I mentioned patience. I would say we have to balance patience with urgency. And that's the trick behind these kinds of assessments, right? There's an urgent crisis that needs to be addressed now. And understandably, there's a lot of, I can't speak for every community. I can speak for Baltimore. We're going on 7 years of 300+ homicides. It's an urgent crisis. Everyone wants to act. So we have to balance expediency with rigor. So perfect is the enemy of good. I couldn't agree more with Dr. Katz. So I would say, just doing something is better than doing nothing. anything that gives you insights into the problem is better than nothing. This is really about just kind of shedding light on the problem as it actually exists so that you can make more informed decisions about how to actually address it.
Yes, absolutely. Thank you. Miranda, any last words?
So along those lines, I would say start somewhere. Like, don't get so caught up in what you don't have and what you feel like that you don't have that it actually keeps you from getting started. So look at what you do have and look at the resources that you do have available, and never underestimate the people in your community, because people are resources. So never underestimate the people in your resources. And so look at what you do have and figure out how you can use what you do have to get a springboard to get started. You know, because again, that perfection mindset, it will keep you from making any progress. It will keep you from moving forward. So just look at what you do have, look at the pieces of the assessment that you can start on, and just get started.
Thank you. Thank you. And Dr. Katz? Oh, you're on mute.
I think everybody has hit on the major pieces. I think that if you're in a situation from a large population center, it's going to look very different than if you're in a rural community. You really need to let local circumstances subscribe and point you in the right direction. I would definitely say as a first point in how you want to move forward is contact the National Gang Center. I don't mean to put all the pressure on them, but shoot them an email and they can guide you in terms of just these initial first steps in getting you thinking about how to proceed forward. And quite frankly, that would be my first step if I was going to be getting ready to move forward with an assessment, would be that reaching out to the Gang Center and allowing them to give you a few minutes of advice in terms of where to start off.
Thank you for that. Thank you for that plug. So Miranda Eccles, Jeremy Biddle, Dr. Charles Katz, thank you so much. This was an excellent discussion, and we really and truly value your input here. So with that, I will turn it back over to Sterling.
I want to thank all of you for such a great session today. To our audience, if you have any questions that were not addressed today, or if you're in need of any additional resources, you can reach out to the National Gang Center at information@nationalgangcenter.gov or our website. As a reminder, there will be additional webinars in this series to provide participants with a more in-depth understanding of effective strategies to address gangs. We will notify anyone registered via email when that registration is open for the next webinar in the series. And all of our previous webinars from the series can be found on the National Gang Center YouTube channel. So at this time, we do ask that everyone please take a couple minutes to complete the feedback form coming up on your screen. You can complete this by scanning the QR code with your phone or by clicking the link that was provided in the chat box. You may also be directed to this once you leave the webinar. This survey is completely anonymous and provides incredibly valuable information to guide our work. If you would like to receive a certificate for your attendance today, we also ask that you complete the survey. Upon completion, you will be directed to a form where you can request your certificate. We will leave the link up for a few minutes so that everyone can take the time to respond. And we just want to thank you all again, thank our panelists as well as our moderator and presenter for such a great session today. And thank you all for joining us. But this will now conclude today's webinar. Have a great day.